Welcome back to NCLEX Map, where precision meets clinical judgment. Now that you've mastered airway, breathing, and circulation, let's dive into NCLEX application and strategy tips, the key to consistently choosing the right answer. When faced with a tricky NCLEX question, take a moment to apply your ABC lens. Ask yourself, is there an immediate threat to oxygen or blood flow? If so, act, don't assess. If not, then assess before implementing. Let's decode the cues that signal airway and breathing issues. Words like stridor, gurgling, or cyanosis indicate danger. If you notice restlessness or confusion, treat them as early signs of hypoxia. Prioritize airway or breathing first. For circulation, keep an eye out for bleeding, hypotension, or tachycardia. These are your shock clues. Focus on interventions that restore perfusion, IV fluids, pressure, or monitoring, before comfort or paperwork. Beware of NCLEX traps. Options involving teaching or comfort are important, but they never outrank ABCs. If the airway is compromised or the pressure is dropping, nothing else matters until stability is restored. Here's a classic NCLEX rule. When the stem says, "Client just returned from surgery," your first action is to assess airway patency before pain control. Post-anesthesia swelling can obstruct breathing in seconds. If all ABCs are stable, shift to frameworks like Maslow, safety, and nursing process. Address physiological needs first, then safety, followed by assessment before teaching. Let's summarize the ABC logic into a quick guide chart you can visualize on exam day. This will be your clinical compass for every priority question. A. Airway. Assess for stridor, choking, or GC is EOS 8. Action. Open airway, suction. Prepare for intubation. NCLEX Q. Cannot speak or gurgling means airway is compromised. Act now. B. Breathing. Assess RR. 8 or 30 and SpO2. G90. Action. Apply oxygen. Elevate the head of the bed. Assess lung sounds. NCLEX Q. Dyspnea or cyanosis. Prioritize oxygenation above all else. C. Circulation. Assess BP 90. Weak pulse or active bleeding. Action. Start IV fluids. Apply pressure. Monitor ECG. NCLEX Q. Hypotension or shock. Always treat perfusion before pain. Now let's test your reasoning with a realistic scenario. You're caring for a 42-year-old post-thyroidectomy patient who becomes anxious and hoarse, with stridor and difficulty breathing. What should you do first? Let's analyze using ABCs. Airway is compromised due to laryngeal edema. Breathing shows stridor, indicating impending obstruction. Circulation is stable, BP 120/70. Airway takes priority. Your next move is crucial. Your action. Call the rapid response. Maintain airway with jaw thrust. Prepare for emergency tracheostomy, and deliver humidified oxygen. Rationale. Airway obstruction after thyroid surgery can be fatal if not recognized immediately. Expected. Lex question. What is the nurse's priority action? Correct answer. Maintain a patent airway by preparing for emergency tracheostomy and ensuring oxygen availability. When airway is threatened, you act, not teach. Notice how applying ABCs clarifies confusion instantly. Whether the scenario involves trauma, surgery, or infection, airway and oxygen always rule the decision tree. Here's a quick mindset reset before the exam. Airway before breathing. Breathing before circulation. Circulation before comfort. If all are stable, then consider psychosocial or educational needs. Each NCLEX question hides a pattern. Find the unstable patient, spot the ABC threat, and answer with the action that restores safety. That's real clinical judgment, tested under time and pressure. Evidence from NCSBN, ATI, and Kaplan confirms. ABCs remain the top priority framework in NCLEX scoring models for identifying safe practice. You're graded not for memorization, but for recognizing who will die first without your intervention. Let's wrap it up. The ABCs aren't just a test trick. They're how nurses think in real life. Apply them at the bedside, in simulations, and every time you face multiple clients needing care. When in doubt, return to your foundation. If oxygen can't get in or blood can't move, no teaching plan or comfort measure can save the patient. Stability first, everything else later. If this strategy session sharpened your NCLEX mindset, don't keep it to yourself. Share it with your classmates and study partners. Like, subscribe, and stay connected to NCLEX Map, the power engine where critical thinking transforms into confident action. Thank you for joining us, and we'll see you in our next video, where we make complex nursing concepts simple, clear, and unforgettable.